Namaskar, I am Madhuri Shukla. I welcome you all on behalf of Uday India Digital. Today, the private sector acts as a vibrant force in the Indian healthcare industry, with over 70% contribution in healthcare delivery. To understand how a young entrepreneur is succeeding in running the state of the hospital at Jaipur, we have a very special guest with us. He is Dr. Sarvesh Agarwal, Vice President and CEO of Rajasthan Hospital Limited, joining us from Jaipur in Rajasthan. Welcome to the show, Mr. Dr. Sarvesh.
It's a pleasure to be here.
Great. So, Dr. Savesh, he is a young entrepreneur running a state of the art multi speciality hospital, having a 500 bedded project with a current capacity of 250 beds for patients. And your patients come from across India and also from South Asia. So, we would like to know more about the hospital and your project. What is the USP of Rajasthan hospitals?
Right. We at Rajasthan Hospital believe in healthcare as a triad of three things, which is quality, access, and affordability. In
Hmm.
short, ensuring that access of quality healthcare,
Hmm.
which is affordable for all, is available at all times.
Okay.
So to ensure that uh, we have all the state of the art facilities in a hospital, starting right from the very basic concept of patient centric care to excellence in nursing care, to
Mhm.
highly advanced infection control practices, to community engagement,
Uh-huh.
to actually kind of build an environment in a hospital which gives us an aura of a healing home rather than a hospital. We ensure that our healthcare staff and doctors excel in their relevant specialties and care deeply for the patient's well-being.
That's a
From
very
specialties
noble thought. Yeah.
from specialties such as cardiology,
Hmm.
we are doing state of the art cardiology work over here, including trans-aortic valvular replacement, in which we are the probably the largest center of South Asia. We are
Hmm.
doing everyday groundbreaking work in respiratory medicine.
Hmm.
In COVID rehabilitation, our COVID rehabilitation center was perhaps the largest of its kind in the state. In de-addiction psychiatry, in retina treatments, in interventional neurology. We are about to start one of the largest cancer centers of the state very soon, looking at the burden of the disease. So I would not say that the USP of the hospital per se is specific to any specialties that we are doing. We
Hmm.
encompass the entire spectrum of healthcare, but
Hmm.
we focus that healthcare is quality healthcare, which is accessible to everyone and is affordable for everyone.
That's wonderful. And like you mentioned that COVID care is a very special wing that you've worked on. So I would like to tell our viewers that an interesting fact about the hospital is that it started right before the critical first phase of COVID, and because of the surge of patients, because of the pandemic, um, expert healthcare was much needed everywhere across the world, of course, in India and in Rajasthan. So in this dire need of healthcare, you exclusively dedicated 2 towers of your new hospital for COVID patient care. So what led to this confidence in building, dedicating this for COVID care? And
Yeah,
was it
that's a
affordable
very
to yeah, just to add to this, was it affordable to the common man?
yeah. I think that's a very interesting question, and it has a very interesting story at the back of it. So
Mm-hmm.
we started probably an year before COVID. We started the operations of a hospital, and we were
Hmm.
just in the middle of scaling up our operations when the COVID pandemic hit the
Yeah.
country.
Yeah.
At that point, there was a very difficult uh, s- position for us to make a decision of how to go about doing things. So,
Hmm.
on one hand, we had a way where we could continue on our current path and continue building up our super specialty services and continue building up our hospital in the way we had imagined it. But on the
Mm-hmm.
second way, on the second path, we could see that our nation, our society, the people around
Yes.
us, our
Yeah.
friends, our family, the people whom we get up and sit down daily with, those were the people who required our help.
Yeah.
So we suddenly got up one day and decided that we are going to completely make our hospital as a COVID hospital.
Okay.
And during the middle of the pandemic, we were right before the pandemic, we were functioning with only 50 beds. But during the
Oh.
entire spectrum of the pandemic, we increased our bed strength to 250 beds. On the
Oh.
call of the government, on the call of our Honorable Prime Minister Modi ji, on the call of our society, we ensured that we scale up our services because that was the time when our uh, entire community needed us. And I think it's, in hindsight, it was very good for us as an institution because it binded all of us, the people of this organization, together, because we
Hmm.
went through that entire hardship as one. And
Yeah.
also,
True.
it actually generated a lot of goodwill for us in the society because we, as people of society, were able to help the society in these difficult times, which was, in hindsight, again, it's still very pleasing to us. When you talk about affordability, uh, I am very proud to say that during the entire COVID pandemic, we always functioned with the guidelines specified by the government in terms of affordability. And I can surely say that our hospital was amongst the most affordable hospital, not just in Jaipur, not just in
Mm-hmm.
Rajasthan, but in the entire country. We were getting patients from all over the country. We were getting patients from Delhi, from Chandigarh, from Chennai, from Bangalore, from Ranchi. We were getting patients from all over the country. And the quality of care that we were able to give at such an affordable rate was something that will always stay with us and is something that actually affirmed our mission statement, which is to provide quality care at affordable cost.
This is incredible, actually, the way that you have dedicated your services for such when the country needed you at that time. And so deep diving into the same topic, if we come across another emergency in terms of any natural disaster or accident, uh, are you well prepared to deal with it? Do you have the capacity to deal with it?
Yeah. So I think COVID taught us all that
Hmm.
we can never know when an epidemic of such epic proportions hit us.
Yeah. True.
So to deal with that, we have ensured that we keep those policies in place which we had created during that entire COVID pandemic, which includes uh, running mock drills for epidemics every quarter, which includes us letting our staff and our doctors train into dealing with mass casualties at once. So that is
Hmm.
an ongoing process. And I believe that everyone, not just us, everyone who has come through this pandemic now has
Hmm.
a fair bit of idea how to deal with this kind of a situation going further. And I think it would help us as a country massively come the next pandemic or next natural disaster whenever it happens.
Yeah, true, very true. That we've learned our lesson, and we are all prepared now for anything which comes our way. So you also mentioned that how dedicated you are as in terms of your social responsibility, but you're also an entrepreneur. So you're the second generation entrepreneur, a healthcare entrepreneur. So what prompted you to join healthcare management?
So I grew up in a family where my father started with a single chamber OPD,
Okay.
and he went along to start some of the most innovative aspects of healthcare you can ever envision. So in
Mm-hmm.
1995, he started the first private blood bank of the state. That was a
Uh-huh.
time when blood was not available for the patients of the state, and
Okay.
there was no private blood bank. Even the government blood banks were only in one or two places, and they did not have enough capacity to
Mm-hmm.
give blood to people. You know what it did? It decreased
Mm.
the number of surgeries that could happen in the state because surgeons were
Wow.
not confident enough to actually admit patients who would require copious amounts of blood.
Yeah.
The patients suffering from dengue or patients suffering from acute hemorrhagic fevers, they were not being admitted in the private setup as well. As a whole, the healthcare system was very, very less developed during that time. That was the time when my father decided to start a private blood bank of the state, and was the first private blood bank of the state, and still is the largest private blood bank of the state. Then he went ahead, he started the first private nursing school of the state because there was a dire need of healthcare professionals, healthcare personnel to aid the growing up and evolving healthcare scenario of the state, to cater to the healthcare delivery system of the state.
Hmm. Hmm.
So I've actually grown up in that kind of a family, in that kind of an
Environment.
environment. So
Mm.
that kind of environment has always enthused me to see what can be done to improve and to make the future better than today. And
Hmm.
that's something that keeps on driving me day in and day out. For me, getting into an MBBS, because I was a son of a doctor, so for me, getting into an MBBS was a basic necessity that I had to do. That I grew up dreaming of becoming a
Yes.
doctor.
Yeah.
But
Yeah.
as I grew up and as I started my medical studies, I realized that there's a whole different spectrum of healthcare, which is not limited to the hospitals, which encompasses education, which encompasses the pharma and the medical devices, which encompasses health information technology. Healthcare is so big. Healthcare is like an entire vast industry in itself. So
Yes.
to
True.
to actually participate in that entire industry, I decided that I don't want to restrict myself to a very specific setting and would like to widen my
Explore.
horizons.
Yeah. Yeah.
That's when I
Great.
decided to get into healthcare management. I did my MBA from Duke University in
Hmm.
USA, and
Hmm.
I worked with some of the sharpest mind of healthcare in the world. And I actually also worked in Cardinal Health, which is one of the largest healthcare delivery provider chain in the world. So it has given me a lot of insights, and I'm humbled to be born in such a place where I can actually dream
Give back
of
to the society. Yeah.
giving back to the society. Yeah.
Yeah, great. That's very inspiring, that you've exposed yourself to the sharpest minds and then come back and giving back to uh, India. So finally, I would like to know that, how do you see the healthcare scenario in India in the coming years, in the next 5 years? Where do
Yeah.
you see it going?
I'm actually very excited and optimistic about it. In
Uh-huh.
2017, when I finished my MBA, I still
Mm.
remember my father gave me a call 3 months before I was finishing my MBA. I had actually accepted an offer to work in US for the company that I
Mm.
was talking about. So I'd accepted their offer to work there full time. My
Mm.
dad called me up one day. He said that, why do you want to stay over here? There's such an exciting work that's happening in India. There's such exciting times. It took
Yeah.
him some while to convince me to come back, but I think that was perhaps the best decision that I took. Uh,
Mm.
I can see the Indian healthcare scenario widely changing and continue to evolve over the next 5 to 10 years rapidly. We were called the dispensaries of the world. In
Mhm.
COVID, we started being called the vaccine dispensary of the world. And
Yeah.
now, very soon, you will see that India will be called the medical school of the world. You go to
Hmm.
any country of the world, you will see Indian healthcare professionals over there. The reason the healthcare education standards of our country, especially in doctors, are very, very high. So so the healthcare education aspect of the country is booming and will continue to grow and cater to the entire world. Then I think India can be proud of its socialized healthcare virtues.
Hmm.
So if you see, at one end of the spectrum is United States, which is completely capitalized healthcare. And then on the other end of the spectrum, you see something like a UK, which is absolutely completely socialized healthcare. Both of them are not very, what you would say, practical in sense. In UK, you still have to wait 1 month or 2 months to get an appointment for a doctor for a non-emergency service. And in US, you will probably end up paying your month's worth of salary if you went to see a doctor. So
Right.
India comes in between them, and we are very well placed in terms of the infrastructure and the policies that the government has created, right from the Chiranjeevi scheme to promoting the private sector to enable services and impart services based on the various government policies. Uh, Health is wealth, and the government understands that, and the work that they're doing is remarkable. Then comes the digital health mission that has been enabled,
Right.
although the fine tuning of it still remains. But it's again something which is very exciting because uh, the digital health data can be really valuable for any medical professional or a medical person and even medical companies to improve the patient outcomes and to ensure that we impart better efficiency of better care, more
Yeah.
efficient care at a lower
Hmm.
cost, which is again something that is very that a population is really sensitive to. So I see the Indian healthcare scenario evolving rapidly because of these points, and I see that this is probably the most exciting time to be here. And I think we'll talk about it 5 years later, and we'll see where we have come and where we have gone.
Definitely, we definitely agree with you that we have the talent, we have the zeal, we have the dedication, we have the resources, and we have young uh, minds like you who have who see the Indian healthcare scenario uh, to the brightest level it can reach in the coming time. So we thank you, Dr. Sarvesh, for your time today and for sharing your thoughts with us at Digital Uday India. Thank you so much.
Thank you, Madhuri ji. Have a good day.
You
Yeah.
too.